everybody, and welcome to this new short video presentation from ARIA EpiTalk series. I hope you will enjoy it and join me in my future video presentations. Thank you. Our patient is a 49-year-old man with persistent atrial fibrillation who was admitted to our center for catheter ablation of atrial fibrillation. In the past medical history, he said that early in October, he had only fatigue and headache, no fever, no respiratory symptoms, and the family physician made a PCR test for him and the test was positive. So at the early October, he had a mild COVID-19 infection without fever, without respiratory symptoms or other typical symptoms. Before admission, 2 PCR tests were negative and the patient received at our center and cardiac MRI as a routine procedure before pulmonary vein ablation and isolation. In MRI, we can see pulmonary fibrosis despite mild clinical course of the COVID-19 infection. On the same side, at another level, we can see also the pulmonary fibrosis as a consequence of COVID-19 infection. In cardiac MRI, there was no evidence of myocarditis. However, there was a large late gadolinium enhancement at inferior valve. It is very difficult to say if this is also related to the COVID-19 infection. Most probably it's not related to the infection. Coronary angiography was done previously and was normal, and ejection fraction in MRI was 49%. So, at the end, the MRI findings in this patient remind us of potential long-term consequences of COVID-19 infection, even in clinically mild forms. And it should encourage us to do everything to reduce the rate of infection among our patients, in our hospitals, and in our communities. I hope you enjoyed this presentation, and I would like to invite you joining me here in my future short videos. Thank you for your attention.